Dr. Danyo, welcome back. How are you?
Clark, how are you doing?
I'm great. Wonderful to see you. Always loving just the time together. And I feel like every time we come together, even though we've been doing dozens and dozens of episodes over the years, I'm always learning something new.
It's what it's all about.
And I always loved it to uncover how you approach this. And there's you and your team, you're always finding ways to make improvements in your process. And it really is, I've heard you in the past talk about it's sort of like an orchestra. It's a real art to this work.
Well, and I think the podcast, there's so much confusion out there. We're going to talk on a great topic today about non-surgical treatments for hair loss. And that's where kind of the salesy stuff with products and shampoos, and it's a multi-billion-dollar industry, but does it work? Especially does it work for every patient or person? I think that's what we're going to talk about today.
Yeah, I'm really curious because we've talked in the past so much about the art and the work that you're doing, but there's like you said, a multi-billion-dollar industry also happening where I get overwhelmed. I'm seeing a bunch of ads, all sorts of products. I see billboards. I'm sure someone who's also watching or listening to this now, they're probably seeing a lot of this too, some of the noise out there. So just to sort of level set, what is on the surface of, are we talking creams, products? Like what does this industry consist of?
Yeah, I think we need to kind of break this down into three different parts. The first one, let's talk about kind of the commercial side of things, shampoos, pills that you can order over the counter or online, such as nutritional supplements, things like that. The next one, let's get into more medical management, where you get a prescription for something from a physician. And then third, and this is something that is really important for, I think, everybody who's got hair thinning, is what products do you use to actually maximize the appearance of your hair? And this is not like in hair restoration, but we need to actually, just like putting on cologne or deodorant, we get ready in the morning and just having a routine to actually thicken your hair and make it look better, even though it's thin. So I think we've got a lot to talk about.
Yes. Okay, so the first one you mentioned, commercial products, pills, shampoos, like specialty shampoos they're really selling it as a commercial, non-surgical hair restoration solution. A pill? Like what? A shampoo? Like what's your, you've been doing this for over a decade, specifically this work. Like what's your take on a magic pill?
So I think the biggest thing is when, as a consumer, whenever you see something called clinically tested, that is somewhat of a red flag. Because clinically tested does not mean scientifically proven.
You can clinically test anything. Is that why?
Exactly. Yes. And quite frankly, in medicine, there are very few things that are scientifically proven. So if you're buying a product because it's clinically tested, thinking that it's going to be a magic solution, there's not a lot of evidence. And I can tell you, seeing thousands of patients, I can't think of one product on the market where consistently people say, I started this 6 months ago, my hair grew back, or I'm using this special shampoo and my hair is so much thicker. And now I say that as more of a blanket statement. There are some patients, and it all depends on what type of hair loss you have, if you have shedding, if there's some thinning out, if there's actual hair loss. And you have to think of it like a spectrum. So like if there's some mild shedding, that might be kind of lower on the spectrum. And then all the way to hair loss would be kind of more major on the spectrum. As you get more major on the spectrum, I just find that anything over the counter is not going to be effective. And it's just not going to bring the happiness that you're looking for. I think if you're really low on the spectrum, maybe some mild shedding and maybe some mild thinning, especially in women. Some of the nutritional supplements can help. I mean, one that's advertised all the time is Nutrafol. I've had some patients have some improvement with that, but again, they're way on the kind of the easy spectrum, not on the more advanced spectrum.
Right, and if you get on that more advanced spectrum, you're really wanting results. And
yes.
And if you see something like clinically tested, or you see something that seems like it's real, it seems like it's going to help.
Yeah, and people talk about DHT blocking shampoos or DHT blocking supplements.
DHT,
which is dihydrotestosterone. That's kind of the main cause for androgenetic alopecia, which is male pattern hair loss, and is very common with females, although we're getting away from androgenetic alopecia for females and just calling it patterned hair loss for women, because it's a little bit more multi-genetic, and there are a lot of other factors that go into what's going on with the hair thinning.
There's just so much noise out there, and it's overwhelming.
There's noise, yeah. Well, what I was going to say is there isn't a true DHT blocking shampoo, and again,
there is or
tested,
is not?
Is not.
Okay.
And again, clinically tested is not scientifically proven. So I think it's important, if you're going to do this stuff, especially if it's really expensive, don't put all your hopes in this, and try not to spend a lot of money on it if you can. Some of these products are really expensive, especially if it's more like a monthly recurring fee and mailing that comes to your house. So just be careful.
Thank you for mapping that out. You mentioned in the second of three categories, medical management as a non-surgical option for hair restoration. What does medical management mean? What does that include? Yeah,
so medical management would be the use of dihydrotestosterone blockers, DHT blockers. The most common would be a medicine called finasteride. The trade name is Propecia. I generally write finasteride because the generic is equivalent, and it's so much less expensive. The next would be minoxidil. You've heard of Rogaine before. That's minoxidil. Rogaine and minoxidil solutions are applied to the scalp. And then there's also an oral form of minoxidil. And I generally find that oral form is so much more effective. We generally start at 2.5 milligrams for men, and have the women split the tablets in half for a couple weeks at 1.25 milligrams every day. And that has been very promising, and there's more scientific literature that it's effective.
There's actual scientific. It's not just a clinically proven quote.
Well, topical Rogaine has some scientific evidence, but I definitely, from what I've seen, kind of research-wise and in my own practice, it's better tolerated, and you don't get the itching and flaking of the scalp by putting it on topically. And it's more uniform, because I'd say about 50% of people don't have the enzymatic activity in the scalp to actually convert minoxidil to minoxidil sulfate, which is the active form. So you could be using it for years, and it's not working in a topical manner. But when you take it by mouth, it gets converted by the liver into minoxidil sulfate, which is the active form.
That makes a lot of sense. In previous episodes, we've talked about shaveless FUE and what that is. And one of the ways I've come to understand it is it's almost like you're taking a tree, you're taking an individual hair follicle, and it's like digging up a tree and then replanting that tree. And so you have, the root system and all that. And so the example I'm thinking of is, this might not be a good example, but if you have like a plant, it's almost like you're treating like it's in the soil, like it's inside you, and then that is coming up through the roots into the plant, and it's going to be a lot more sustainable than just spraying on topical. So you want it to be inside of you, is what you're describing is why the oral form of one of these medications is so much more effective.
Yes. And there was actually an article in our last hair restoration forum that talked about oral minoxidil and also getting people's diet under control. One of the theories about hair loss is that there's kind of an inflammatory process that can kind of upregulate those dihydrotestosterone receptors, and a very poor diet, one that's kind of more carb-laden, kind of sugars, unrefined sugars, all that stuff, can have an effect. So when you get your diet under control and really start limiting processed carbohydrates, and combining minoxidil, that actually had better results than just minoxidil alone. So
okay, that makes a lot of sense. It's the nutrients you have. We hear about things like stress. Like you hear the phrase, like, I'm pulling my hair out, my hair's falling out, I'm stressed out. Is that sort of part of that holistic look?
It can. I mean, stress can definitely cause shedding, but I also think prolonged stress, where there's prolonged adrenal gland inflammation, activation, and just kind of whole body inflammation. And a lot of times that stress then carries into just poor eating habits and just poor physicality. And then you develop something called metabolic syndrome. That has a negative effect. I would say it's not as powerful as the genetic effect of androgenetic alopecia, male pattern hair loss, or even female pattern hair loss, which is more genetic. But it can be part of the mix, and that article that was recently published alluded to that.
Very interesting. Always learning more. You also, this might be a good segue to talk a little about this third category, products that boost appearance. I think you mentioned there's some natural things here. This sounds like we might be moving in that direction, right? What is that all about?
Well, I wouldn't say natural things. I mean, a lot of people do use essential oils and things like that. I haven't seen a ton of literature or heard a lot of talk at our conferences about that, but some of my patients swear by that. I don't know which ones to use. But what I'm talking about is to use thickening conditioners. And there's a great product by L'Oreal called Thickening Conditioner. It's in kind of a mint green bottle. You can buy it at any CVS or Walmart. And when you get out of the shower, just put some of that in your hands, and then just put it through your hair. And then blow dry the conditioner into your hair. You can get instant thickness of the appearance. It texturizes the hair, kind of coats it. And that texture, especially with people that have thin hair, can create a lot of volume, like amazing amount of volume instantly. So it's a product that I use often. I've been honest about my journey with hair loss and hair transplant, and I'm going to be getting some more soon. I'll keep everybody posted on that.
Yeah. Who does that for you? How do you manage that? We've not talked about that.
My first hair transplant was in 2012. And when I was just getting into the industry and bought a machine, and at that time, there weren't very few doctors doing FUE, and in fact, it was very, very expensive to do. And so at that time, I had planned on getting things going and had some technicians work on me, which I say is not a good idea. And I can vouch for that. It was not a good idea because the results were not all that great first time around. And then I had a second procedure by a friend in 2015, and that's kind of what you see in my head now. I think I'd be almost bald if I hadn't had hair transplants. So,
wow, I appreciate you sharing that.
Yeah, but really for me, when I use especially that L'Oreal thickening conditioner, and the second thing is to use keratin fibers.
Keratin fibers.
And kind of the most popular one is Toppik, Toppik. There's also Kabuki, SureThick. There are a number of products. Sometimes you have to try different ones because they have different colors. And one of the problems with the Toppik is that dark brown is almost black, and medium brown is pretty dark. But then the light brown is almost blonde. So sometimes you even have to combine fibers to get the look that you're trying to get. Or, different companies have different shades that actually work better for your hair color. From a cosmetic standpoint, this does nothing to restore anything, but it provides immediate relief. And it can be something you do maybe when you go out for dinner or go to a party, or it might be your daily routine. But I think it's oftentimes overlooked and under-discussed. And I think it's very important to get into a good cosmetic appearance routine for your hair.
it's a huge part of our identity. We've talked about that before, and that's why this is such an important podcast for someone who's trying to learn more about this. And, it's great to just hear someone like yourself. You've been in this space. I did not know that about your own journey. And you got involved doing this shaveless FUE in 2013, so that must have been a big impact on you. And you have a tremendous amount of passion in this work that you do. And so I think that just continues to speak to that.
I think if you go about life, that each day should be a better day, and you should learn more and take chances and experience things. That's how you grow, and that's kind of how I've approached life and this practice. And I think the podcast, all the equipment that I've brought in, my discussions with you, the testimonials that we do, everything is really not to be a sales job. But really be instructive, because it's a mess out there on the web, and I'm just trying to make some sense out there.
Absolutely. I love it. I'm always learning more every time we connect. And so I think this answers most of my questions I had for you on this session. Any final thoughts you want to leave us with before we meet again?
I think if you are having hair loss, especially if it's early on and you're young, definitely consider medical management as a primary way to keep your hair and restore it to some degree. If you're more advanced on the scale with severe hair loss or more progressive hair loss, I think you need to focus on hair transplant as the solution, especially if it's your frontal hairline or a large spot in your crown. And don't get too caught up in the hype of these clinically tested products that are not scientifically proven to regrow hair. The next step would be to find a qualified physician who actually does the consults, to sit down, figure out what's going on, and come up with a great treatment plan for you.
Great. I know you, Dr. Danyo, and your team, you're a wonderful resource for someone to consider on this journey, and we have an easy way for someone to connect with you and your team on that. So with that said, thank you, as always, for taking the time, and I'm looking forward to our next discussion.
Thank you, Clark.
Hey, thanks so much for listening to Hair Restoration with Dr. Daniel A. Danyo. Book your consultation today with Dr. Danyo by calling 678-845-7521 or online at nahairrestoration.com. And be sure to follow, rate, and review this show wherever you listen to your favorite podcasts.